Minister's response.
Well, my Lords, I thank the Noble Lord, Lord Boateng, for tabling this debate and for all the Noble Lords who have taken part in it. It has been urgent, passionate, but also focused. As the Noble Lord, Lord Brown, put it, it has demonstrated the rich seam of knowledge, wisdom and humanity in your Lordship's house. My Lords, it's been almost 19 months since the first cases of COVID-19 were reported and 9 months since widespread international vaccination programmes began. Yet, as Noble Lords have rightly said today, too many people remain unvaccinated, and particularly in the global south. The rapid spread of the Delta variant illustrates what we've known from the very beginning, and what the Noble Baroness Lady Lawrence and others echoed today, that nobody is safe until everyone is safe. Worldwide vaccination is essential to beat the pandemic, and UK science and diplomacy have been pivotal to the progress which has been made so far. From the outset, Her Majesty's Government has advocated rapid and equitable access to vaccines, and we've helped to drive the global response, including by hosting, as Noble Lords noted, the Global Vaccine Summit, and through our presidencies of the G7 and the UN Security Council. So we have been a champion for global action in this important area. We've worked closely with our partners to design, fund and implement the COVAX facility, which is an unprecedented initiative led by the World Health Organization, the Global Vaccine Alliance, Gavi, and the Coalition for Epidemic Preparedness Innovations, or CEPI. COVAX has brought together 191 countries to fund, develop, manufacture and deliver COVID vaccines, particularly to the global south. And its advanced market commitment is focused on providing safe and effective vaccines to up to 92 low and middle income countries. From Benin to Zambia, from Bangladesh to Timor-Leste, it is delivering vaccines across the world. It was launched at the Global Vaccine Summit, which we hosted in June last year. The UK was among its founding donors, and our total commitment of £548 million is amongst the largest of any donors. And thanks to our leadership at the UN General Assembly and our match funding campaign, we helped to mobilise an additional $1 billion for COVAX from other donors by the end of 2021. The Noble Lord, Lord Boateng, rightly talked about the resources which have been made available, but our work has helped to mobilise the resources which have been made available so far. And by leading this early funding drive, we gave COVAX the purchasing power that it needed to secure its first deals with manufacturers, which locked in the supply of internationally approved vaccines. The first COVAX shots, vaccines from the University of Oxford and AstraZeneca, were delivered to Côte d'Ivoire and to Ghana in March this year, just 4 months after the first vaccination in the UK, and historically unprecedented speed. So from a standing start in June last year, COVAX has now delivered more than 230 million vaccine doses to 139 countries and territories, including 87 low and middle income countries. Manufacturing vaccines at scale is difficult even for experienced companies, and delays in production have slowed progress, a frustrating fact which has rightly been echoed throughout today's debate. But COVAX vaccine rollout is now poised to accelerate with new funding, supply agreements and donation commitments in place, which will provide 1.8 billion vaccines to low and middle income countries for early 2022. That, my lords, will protect millions of frontline healthcare workers and other vulnerable people. But as the Noble Lord Boateng and others have done, it's right to draw attention to the discrepancy between the number of vaccines available in the UK and elsewhere in the world. The first duty of the government, just as all governments around the world, is to ensure that we have sufficient vaccine supplies for our own domestic rollout, and I'm sure Noble Lords would not disagree with that, and we're ensuring that we have sufficient future supplies for the UK need alongside meeting our G7 commitments. But alongside this, and as Noble Lords have said today, making vaccines available globally not only helps the coronavirus pandemic in developing countries and is the morally right thing to do, but it will also reduce the threat posed by vaccine-resistant variants which are emerging and which could pose a threat to us all. As my noble friend Baroness Sugg put it, it is in our enlightened self-interest as a force for good in the world through our participation in COVAX and by sharing vaccines bilaterally. The UK is therefore also championing the need for access for all countries. At the G7 Leaders Summit in Cornwall, the UK committed to sharing 100 million COVID-19 vaccine doses within 12 months, including 30 million by the end of this year. Of these, 80% will go to COVAX to accelerate support to countries in need. My noble friend Baroness Sugg and others asked how many have been delivered so far. To date, the UK has delivered over 9 million doses, ahead of our target for the end of September, of which half are helping to meet the urgent need for vaccines in countries across Africa, Southeast Asia and in the Caribbean. UK donations are already helping to immunise health workers and those most vulnerable to serious illness from COVID and to protecting health systems. Our 100 million doses are part of the broader G7 promise to finance and donate 1 billion safe and effective vaccines worldwide by June next year. My noble friend Baroness Sugg and many others asked whether we can commit, asked about the taking of vaccines from COVAX for UK use. My lords, as well as being one of the largest donors to COVAX, the UK was one of the earliest, and that is pertinent here because the UK opted into procuring the Pfizer vaccine through COVAX at a time when this was the only vaccine demonstrated to be effective and approved by the UK regulator. COVAX subsequently decided, after consulting those participating, to procure only a small amount of the Pfizer vaccine because it is, as noble lords will know, difficult for many countries to deploy given the challenge of establishing the very cold temperatures at which it needs to be stored in the delivery chain. But our early funding, which we gave to COVAX, gave it the purchasing power that it needed to secure deals with manufacturers to supply internationally approved vaccines for low and middle income countries. These practical points lead to questions which the noble Baroness Lady Lawrence and others posed about donating vaccines with short shelf lives. We agree that adequate shelf life is important for all vaccines supplied to all countries. We're aiming for all donated and dose-shared vaccines to have a minimum of 2-month shelf life in line with Gavi and COVAX guidance. The partner governments are free to refuse donations if they're concerned about expiry dates. They're working to ensure rapid rollout of shared doses to priority groups, including people who need a second dose, and to prevent wastage. And the WHO EUL vaccines are approved with a 6-month expiry date at present, which may be reviewed by the WHO depending on emerging stability data. The noble Baroness also asked what we're doing to speed up vaccine access and to tackle the problems of sell-by dates. We're working through the governing boards to ensure that Gavi and World Bank funding is available for in-country delivery and that it's approved and dispersed in a timely manner. We're also supporting COVAX to become less reliant on Indian-based manufacturers and to diversify its portfolio to manage the risk. The noble Baroness Lady Brinton asked another practical question about new variants which may evade immunity from vaccination. If such a variant emerges, it should be possible for manufacturers to update vaccines to protect against them, but this means scaling up vaccine manufacturing and rolling out vaccines as quickly and as widely as possible. As more people get vaccinated, in addition, we expect virus circulation to decrease, which will lead to fewer mutations, but of course we must track those mutations and variants closely to detect them, and that means carrying out genomic sequencing globally and sharing data. The noble Baroness Lady Bennett of Manor Castle referred to the UK's role in the development of the AstraZeneca vaccine. So much of what we have been debating today would not have been possible without the extraordinary work of our scientists. The UK's scientific excellence and cooperation has enhanced collective knowledge about the virus and led to pivotal breakthroughs. The government's role in supporting AstraZeneca is well known, and we are proud of the helping hand that we gave. It's become the advance there has become an extraordinary gift to global vaccination efforts. More than 1 billion doses have already been delivered at cost, with no profit, around 2/3 of them going to lower and middle income countries, and that has saved countless lives across the globe. We also supported wider international collaboration to develop vaccines. In March last year, the Prime Minister announced £250 million of funding for CEPI to accelerate vaccine development against global threats, including COVID-19. CEPI has supported 11 vaccine candidates, including the approved Moderna vaccine, as well as Novavax, which has showed positive results in clinical trials. The UK will host a replenishment conference to raise funds for CEPI's crucial work on vaccine development in March next year, helping it to realise the aim of making vaccines against new health threats, including new COVID variants, in just 100 days. In addition to our support for vaccines, the UK is a world leader in viral genomic sequencing, which will be important for the reasons I outlined in response to the question from the Noble Baroness Lady Brinton. This has proved crucial in identifying the emergence of new variants and will be essential in ensuring that the vaccines remain effective. Public Health England is already working with 7 countries and the Africa Centres for Disease Control to build their capacity in genomic sequencing. Now, my Lords, a number of Noble Lords raised the issue of manufacturing. The rollout of vaccines has raised important questions about TRIPS, the agreement on trade-related aspects of intellectual property rights, which the Noble Baroness Lady Chakrabarti and others focused on in particular. We have engaged in discussions on intellectual property and a possible TRIPS waiver at the WTO, and we will continue to engage constructively with the US and other WTO members, as the Noble Lord Boateng and others urged. We've not yet, however, seen conclusive evidence that indicates that the removal of intellectual property protections would lead to the scaling up of production or the improvement of the supply of COVID-19 products, including vaccines. So at this point we remain unconvinced on how beneficial a waiver would be. As a practical point, any negotiations in the WTO on a waiver would need unanimous support, which could take a long time. So while we will continue to engage in IP discussions and review the merits of any proposals that are submitted to the TRIPS Council, we must continue to push ahead with pragmatic action now, including voluntary licensing and technology transfer agreements for vaccines, support for COVAX, as I've outlined, and solutions for production bottlenecks and supply chain issues. In addition, my Lords, the UK is co-sponsoring the Ottawa Group's Trade and Health Initiative. This aims to increase cooperation among WTO members, keep medical supply chains open, and lower trade barriers, getting vital supplies, including vaccines, to those who need them most. The voluntary licensing approach taken by the team at Oxford and AstraZeneca has had our full support, as has their collaboration with the Serum Institute of India to scale up manufacturing for global supply. We welcome the work of the new Partnership for African Vaccine Manufacturing, which is developing its roadmap to manufacturing vaccines in Africa, and which is engaging to identify opportunities for partnerships. We have provided technical support to BioVac, a vaccine company in South Africa, to develop an investment case which helped to secure financing to produce COVID vaccines there. We're giving similar support to the Institut Pasteur in Dakar, to companies in Senegal, and to the government of Morocco. Noble Lords also focused on questions of distribution, and we recognise that distribution, particularly in hard-to-reach locations, is a critical challenge in many countries. Investment in delivery is vital in getting jabs into people's arms. Multilateral development banks are playing a central role in funding health systems to deliver vaccines, treatment and testing while maintaining other essential services. And the UK has led engagement with the multilateral banks to strengthen coordination with COVAX and to speed up the processes for applications and the release of funds. The FCDO is also working with UNICEF and other humanitarian partners to ensure that planning and finance is in place to address the challenges of distribution in difficult environments. It's extremely difficult for charities and healthcare workers safely to provide jabs to people living in conflict zones. So the UK used its presidency of the UN Security Council in February to secure unanimous support for a resolution calling for ceasefires in conflict zones to enable vaccine delivery, and we continue to work with our international partners to monitor and support the implementation of that important resolution.
I'm not sure if he's going to be going back to the UK and